We spoke.
Oh, okay, because you got CMCO5. I was like,
Yes, we
who's that?
we spoke last week when I couldn't access the test, and I told you I was gonna do the second diagnosis test.
Yeah,
Remember? And I told
yeah.
you that I already passed the first one, but I was worried because the computer wasn't working. I wanted to do the second one, so I did the
Yeah.
board today.
All right.
It was awesome. Thank you
Mm,
so much. I finished school last month. Well, right after I finished, I started reviewing in the purple book. I couldn't. It was too much for me. I did 1 week and I'm like, I'm overwhelmed.
I
So
mean, yeah.
I saw you on Facebook and I'm like, you know what, let me give it a try. And I don't regret it. So I did 4 weeks. Basically, my 30 days would have been over this Friday.
Wow.
And I basically did all the modules, all the tests. Um, I followed everything you said. So what I did one module like in 2 days, and then after that, I printed the PDF. I studied the PDF. Then I take the test, the test bank.
The test bank. That's it.
Uh-huh. So I was doing that. I did all 5 modules, and then after that, I started on the diagnostic test. But the
And the
only
crash
thing,
course and the crash course review, right? Oh
and I
no.
did the crash course review this weekend with you.
Okay.
And I can
Good.
tell you, I thank you so much. The second day, all my exam came from that. You remember last night in the class when you were talking about Victor?
I have no idea. I don't remember. I mean, I
No,
better replay.
last night when we were doing the therapy.
Yeah.
I
Yeah.
have I have
Viktor Frankl. Yes.
yes, I have 2 questions on Victor.
No way.
Last night,
Really?
I was listening to you and I did not know it and I went back and review it and I'm like, damn, I forgot about that. I review it. I tell you,
Yeah.
the first question I had was Victor.
Oh my. See,
And I
guys,
had
I'm telling you, like, I don't know these things. I just know by what is psychiatry, right? If you know psychiatry well, you know who is who in it, and it becomes easy to kind of like formulate a course that that makes sense rather than making you busy for making you busy. That's not my goal. uh I really try to only cover that it's very high use. So you felt prepared as you taking your questions and you felt like, okay, I got this.
yes, I got this. So when I see the first question, I'm like, I got this. Then they gave me one on Boram, and they say that which of these questions look like Boram
Yeah,
therapy. I went like, bingo, I got this. Then they said they gave me a lot of neurotransmitters. I had
yeah,
a
we
lot
we
of
yeah, we can't talk about specifics, but in general, you felt like every time you're going through a question, you felt that you did good.
exactly. And then so I was doing good, but there's one time they start giving me some questions, a lot of questions about schizophrenia. And I'm like, whoa. But I 1 second. I'm like, okay, let me just take a little snap. So in total, I had flagged 6 questions. I flagged
Yeah.
6. So I finished like exactly in 2 hours. I went back to the one that I flagged. I said, you know what? I'm not gonna change anything. I unflagged them and then I submitted. And there was one I did flag. I did not unflag. They asked me if I wanted to. I said
Yeah.
yes. And then when I got outside, I opened my email. Boom.
Yeah, no, I mean that is the goal. You in and out, but you played hard, right? Like it's not that like in a month you really worked, to complete everything. It's possible to complete in a month, but you worked hard.
Let me say this. Every day I was studying. I work as a family nurse practitioner. Every day
Oh,
I was doing 3 hours every night, but I was very dedicated. No parties, no outing for me. So every day I was doing 3 hours. On the weekend I was doing 6 hours of studying to accomplish the 4 weeks. It was very hard to do the 4 weeks, but all
yeah.
I can say, the 4 weeks was a good thing
Mm-hmm.
because the test was like easy for me because as soon as I see this question, I say, I got this. It's like everything that I know.
Yeah, I mean, and that's what's all about. I don't necessarily recommend people do it in 4 weeks because I know it is pushy. It's a lot of
Yeah.
but the stuff is available. It's not that you have to wait for lectures. It's available. It's there. Everything is there. It's just that I was reading something today that said I don't know if it chimes with you guys or not. It says God can do anything, He can do anything, but the only thing that he cannot do is your job, right?
Exactly.
I mean,
But the only thing that I could say, I would not suggest people to do it because me, I know that my personality, when I want something, I'm gonna get it. It's just like I know that I did when I was doing FNP, I told people I was gonna do two boards. I did both, but this time I told them no, I'm just gonna do ANCC and that's it because I don't have that kind of time in my head. But I push myself really hard to basically get it done.
yeah,
Um,
before Christmas, right? Before Christmas done.
yes, because my plan was like, I'm on vacation. I'm gonna have 2 weeks vacation. I want to spend my 2 weeks vacation
Nice.
because after school, I've been in school. I didn't have no time with the kids really working school. So I
Mm.
said I'm gonna spend my Christmas break with them. And today I told them Merry Christmas early. I
Yeah.
said
Where are you going for vacation?
we
Where?
flying to Paris.
Oh, how nice. How nice. Well, I did the same thing. I booked my travels and my flight the day after the board. And there
Oh.
was no way I was going to repeat that board. I prepared myself really, really, really hard for a whole year. But I would have everything booked, hotels, flights, and everything for the day after.
It's
Because
funny.
yeah.
The lady at the place for the test said, "You came ready, no jewelry, nothing, no glasses, both hands." I said, "I'm ready. Just get me in." She said, "Whoa, let her in."
Let her in. That's right. And that's what I tell people. I say, hey, walking out like it's your house, belongs to you.
Exactly.
Y- y-
And
You know,
like I said, you can do it, but do not overlook. I think everything we discuss in the class, it's for a reason. Just don't overlook, just try to study, like read, listen to the modules. I do listen and I printed all the PDF. I read all of them and I did the crash course with you. But before you even did the crash course, I did already
you get
review
it.
it myself.
Exactly. And those questions that I also sent it out, it was a way of reviewing the crash course without reading
Exactly.
it.
So basically, I followed. You'd say they want to do this question. I reviewed the crash course video and I did the question. Like I said, I spent 3 hours every day. You imagine I leave work, I get home by
Yeah.
6. But like I spent 3 hours. I go to sleep at 11, wake up at 5 a.m. Every day. That was my day for the past 4 weeks. But I got what I wanted.
Can
Yep.
I
You in
can
and
I
out. Yeah, in and out, and you really got it.
Yes.
Anyone has
sorry.
any questions for her about her preparation and so forth?
Yeah, sorry to interrupt. Hey, I don't know who was talking, the female, but the one who just took the exam and passed. Did you feel that doing the diagnostic test 1 to 4 helped you or would be a strong
Yes.
indicator?
All I'm gonna say, do all of them. I did them twice.
Look, I have somebody that done them like 7 times, times four. Can you
Yes.
imagine that? I was just like,
Yes.
I don't know what to make out of it, out of this.
Do like when I said this, print the crash course PDF all 3 days, review them, and for me, most of my question was in the second day, the one that we did Sunday, but I did
Mm.
already review it. And I can tell you, this document is a little godsend for me.
Which one?
Hey,
Which
The,
one?
what
the
I
second
showed you
day,
guys today, yeah,
the
it's
second day.
circuit. Yeah,
You will see it said module 2 PDF 2. And
yeah, but you
under
know,
the first day, you will see it said day 2 PDF. Download that. It's like 70 some pages.
yeah, I mean, guys, I showed you guys yesterday. I circled. I'm gonna pull it up again. There are 3 PDFs. Do not neglect any of them.
Do not
You sh-
neglect any of them.
you know, you have to do it in a way that there is enough time for you to do your diagnostic test, and
Yeah,
preferably don't rush. I mean, for some people they can do it, but it's not for everyone.
exactly. Like me, I did all 4 twice. I have to create times, and I can tell you, I cancel things. You invite me, so I'm sorry, I can't.
I can go.
No,
Yeah, I mean, I
because
know it's hard, but
what I said, Dr. Lopez, on the 21st, when I sign up with you, I said I'm gonna schedule the board today, and I
that's
said,
it.
God, eliminate everything that come my way. Make sure the kids are okay. Let's do this.
Yep. God can, the only thing he cannot do is your job. If you don't want it to do it, he's not going to force you to do it. So you got to create the time, you know. And as I was saying yesterday, hey, if I make a workout be in the afternoon, I know that I will never do it, because when I look at my emails, I know I have tons of emails to answer. I'm like, no, I got to answer those emails. So I got to do it in the morning when there is no distraction. The first thing I do it is go work out, because then I know the rest of my day is going to be easy. And sometimes that's what you need to do. You know, you are busy just like everybody else. And if not even more, you got a full-time job, you got kids, you got a commitment, but you hit it really hard in 30 days and in and out like magic. Yeah, that is super cool. As I was opening my email, because I do have a full-time job, I have a clinic that I manage and all that, and I have to provide coverage. You know, today alone, we had 7 people that passed. Tons of people. Uh,
Yes. I haven't got home yet, but I will send you an email with the copy and everything because I have a
yeah.
special message for you.
Thank you, thank you. Yeah, I'll we'll really look forward to that, and also, you know, see how things are going as you move forward. And it
Yeah.
doesn't mean that if you pass, this is way more than what I really aim for. This is a community. If you ever need some help or some assistance, or just someone else to bounce off ideas, so you know my email. So I'll look forward
Yes,
to your
and I
email for
will.
sure.
I will wait after the holidays. I will
Yeah.
definitely sign up with the psychology, the pharmacology with you. But tonight I'll send you the email with everything that I have to say to you. Thank
Okay.
you so
Well, look
much.
forward to hear from you. Okay. Thanks for coming by and let us
Okay.
know that you passed.
Okay.
Appreciate that.
It was a great 30 days. Thank you.
All right. I'm excited. Take care.
Bye
Bye-bye.
bye.
Dr. Lopez,
Yes. Hi.
good evening.
Good evening.
I have a question. So
Sure.
I took the diagnostic, well, I finished the initial diagnostic exam
Yeah.
and scored like a 62.
So hold on. Are you talking about in the beginning of the course or at the end of
Yes,
the
the
course?
pre.
It doesn't
So just to
matter.
get a baseline,
Oh,
right?
no, it does not matter at all. It is a good thing that you score 62. In fact, that is actually above average. So
Okay.
you're in a good place. I ask you not to look at your score.
Oh, it
Oh, I
pops
mean, I'll
up.
ask you not to look at the questions because you are going to retake the same test. So if
Mm.
you really look at the question, now you invalidated 1 out of the 4 tests. So don't
Oh,
worry
okay.
about your score now. What you need to worry is will next time I take my test will be 80 or better.
Okay.
That is what you need to worry. In the beginning, you know, I don't care. We got people that score 30. It's okay. They may just need a little bit more help, but it does not dictate your outcome. What dictates your outcome is the moment that you join the course, you hit it hard, guys. I'm telling you, we have people here, and I love you all. I will stay with you for 6 months. I will never kick people out like that. But a lot of people start and they stop, and they start from the beginning and they stop. You gotta hit it hard. If you can do it in 30 days, do it in 30 days. If you can do it in 8 weeks, do it in 6 weeks or 8 weeks. I think the best preparation is 9 weeks, 9 to 10 weeks for most, but it's all about your stamina, right? You know, what else is going on in your life that you know that you cannot dedicate 3 hours or 2 hours a day.
And I sent you an email. I'm sure you'll get to it eventually.
Yeah,
I still don't have access to the question bank. I didn't get that email with the link to the question bank.
sure.
So
Yeah,
I did send an email.
yeah, I'll definitely get back to you. I am, you know, as soon as we finish the crash course reviews, you just sent it now, like 1 minute ago. Okay, gotcha. I'll definitely be responding to that soon. But yeah, guys, so like today we had 7 people that passed the board. Who else passed the board here? So many people. Let's see here. Let me give you some names. We got Tammy, Lachey, Lindsay, Kamaja, Amber, uh, Connie, Jenna. I mean, it's so many. I'm telling you guys, hit it hard. Like study, like love it what you do, because this is going to be your life as you move forward in the beginning of 2026 or in the next few days. It is like magic. As soon as we finish the crash course review, man, tons of people will be passing, And it is just a great time because it's Christmas, right? Coming up a few days. I'm excited for my vacation, I gotta say. I don't know if I will be able not to check my computer every day, but I'm excited. All right, so real quick, we got to get started. We got a lot to cover today. Erica, you got something going on that you want to say hello?
Yeah, I just had a question. After you do the modules and there's a practice module test, does that matter? Because I was getting like a 79, 85 on those. You know, when you do the module, like the first module, then there's an exam questions after that. There's
You mean
questions.
you mean question bank?
Yeah, it's in
Yeah. I mean, because the question bank is what you learn from the module, so it does matter, specifically for modules 1, 2, and 3,
yeah.
because there will be most of questions. So that means that, completing things, it doesn't mean a whole lot if you don't retain it or be able to apply it. So you can still move on, but be mindful of the things that you missed and the reason why you missed it. So you
Okay.
can go back to them. Don't ignore them because modules 1, 2, 3, according to the ANCC blueprint, there will be 107 questions. So you really need to focus and get those modules 1, 2, 3 to the teeth. Get them really good, and that pretty much guarantees you a pass. I'll challenge anyone right now that failed the board before, whether not in this class, but in any other class, and then you look at your report, you had high on modules 1, 2, 3, and low 4 and 5. You know when that's going to happen? Never. Because if you really had high on 1, 2, and 3, you can almost, depending how high, you can almost close your eyes and pick any letter and you still would pass because that is the bulk of your testing
Okay. Okay.
question.
Yeah, the module 3, I scored like an 85 on it. Like
Yeah.
80.
So the most important is module 2 because there will be 44 questions for module 2. But 1 and 2 and 3, that's what you need to really revise the PDF continuously. All right. Thanks, Erica. We'll get back
Okay,
to
thank
you at the
you.
end.
Thank you.
All right. Darice or Darcy. I'm sorry. Not Darice.
No, that's okay. It's Darcy. So my question to you is that once we, like you subscribe to the 30 days, do you only have 30 days or can you keep attending these lives as well?
You can, Darcy, we are not, I would say we are not entirely for profit at all. My thing is that once you are in the program, I will support until I can no longer support you. What you need to worry is completing your modules, doing your own independent study, and then coming to the live class and we'll walk you from, have a test date. Otherwise, you might feel fatigue. You might have be studying without knowing what's the end. What is a good time frame for most people would be 9 weeks.
Okay.
As long as you have a plan to complete 1 module per week. So you finish 6 modules, domains 1 through 5, the crash course review. Then you have about 3 weeks to adjust anything else that's missing. So we don't kick you out for sure.
Thank you so much.
Yeah, the clock will stop, but it does not mean that your course will stop, okay?
Okay, thank you.
Alrighty. All right, folks, so we do have lots of grounds to cover. Like I mentioned, it is the best feeling ever. I come home, it's already almost 7:00 p.m. And I open my email and there's just tons of happiness and tons of, students passing from one thing to the next big thing. But with that, just keep in mind, it's not about passing. It carries a lot of responsibility. You'll be dealing with a vulnerable population that depends on you. It depends on you, or what you say or don't say will make a difference. Okay. All right. So we are going to cover lots of modules today. This is module, lots of trainings today. We are starting with module 4, DBT. Names are important. I don't cover a lot of names, Viktor Frankl, Marsha Linehan, Beck, Theodore, Piaget, what else? Carl Rogers. That's pretty much it. But if I mention the name, they're important, right? So for most, I would say, who's the father of? But here is Marsha Linehan. She created DBT, and guess what? Guess what her diagnosis was? DBT, borderline personality disorder, right? You can almost associate DBT, dialectical behavior therapy, with a borderline personality disorder. Okay, so what is DBT? Goal of DBT that is important, that is super high yield, right? We talked about who created DBT, Marsha Linehan. The goal is to decrease suicidal behaviors or self-harming behaviors. Okay, there are lots of reasons why we want to our patients to go to DBT. Let me tell you a secret. DBT is so strict, very strict, that at the end of 16 sessions or so, the therapist needs therapy, and it's not whether they want or not. It is part of the program. Now imagine this. You have a group of 12 individuals with borderline personality disorder. You need to put boundaries. Your name should be boundary, because it's going to be intense. So DBT, the goal that you need to write it down, and you need to understand what is the goal of DBT: to decrease self-harming behavior. That's the number one goal. There are several reasons why. I like this acronym here, DC steps, right? DC steps. What does that mean? Well, I like to make up an acronym. So DC, DE is to decrease what? Crisis. Okay, so decrease crisis behaviors. What else? How about steps? Well, suicidal behaviors. T is for the therapy interfering behaviors, because they do interfere a lot. Emotional reactivity. They're very reactive. Passivity, and decrease self-invalidating. I'm not good for nothing. Nobody loves me, right? So that is DC step. If you don't want to memorize all this, at minimum, know what is the goal of DBT: to decrease crisis-generating behaviors and suicidality. Well, how about DC here? Is to increase in decision-making and communication. Most of them, they have problems with communication. They're unable to have a stable relationship. In order to have a relationship, you need to be able to communicate your feelings on what is going on. All right. Make sure that we have our PDFs. You are reviewing the questions inside of the course. They are high yield. You are there for your knowledge and to increase your chance of passing the board. So don't blow those questions away, okay? You review her medical records, and you review her past diagnosis. Borderline personality disorder is one of the diagnoses that is listed in her record. You do your assessment and you agree with the diagnosis. Well, it said borderline, so what would I recommend this person? Would I prescribe Prozac? No. Would I prescribe interpersonal therapy? Well, it could be, right? But it's not the right answer. Or existential therapy. So we all know is dialectical behavior therapy. Now, I want to call your attention for something here. Prozac, SSRIs. This is a very likely question that you might get, okay? Because, yes, borderline personality disorder is equal to DBT for the sense of the task. Now, there will be times that they may ask you to choose between 4 medication, and you go like, is it lithium? Is it valproic acid? Or is it an SSRI? Ask yourself this question. Does depression symptom comes anywhere in the stem of the question? If that is true, sadness, anxious, depressed, feeling down, take an SSRIs for 2 reasons. One, because it's depression. And reason number 2 is SSRIs is the #1 medication, because even if they do self-harm behavior, right? By overdosing would be the safest. So another reason why is that you want to start with the lower guns, okay? Now, this is borderline, not bipolar. So don't confuse bipolar with borderline, okay? So you don't do SSRIs preferably for bipolar, for borderlines, all right? Okay, so just remember what I said. If you do have depression in the question, make sure that you are selecting a SSRI as a possible answer to consider. Okay, so that was about it. Got one more question, just kidding. So Mrs. Aston is a 24 years old patient who has been diagnosed with borderline personality disorder. She was referred to dialectical behavior therapy a few weeks ago. During this appointment, she told you that the DBT has been helpful, helping her tremendously. Knowing the construct of DBT, what is the number one activity related to DBT that might be helping Mrs. Aston? All right, so I'm not going to read the answer choice. Pick your best answer based on what we covered. Okay. All right. So everybody's picking B, right? So it is very helpful to keep a diary or a journal for borderline personality disorder, because we want to know what are the triggers before and after during their tantrum proceed, right? So we can review and reflect on those entries, right? So that is very important. However, it is not keep a journal, diary and journal, right? So it's not uh DSM-5. Did I circle B? It's not a DSM-5 requirement, okay? All right, so I put a D here, but you guys can see that it is B, right? So I saw the D, I was like, that's not right. Okay, great. All right, so that is B, not D, but the writing is correct. Keep a diary or journal to keep a record of exhibiting behaviors, response, and triggers before and during outbursts, and review and reflect on the entries. Again, very, very helpful, but it's not per DSM-5 as you must. It is helpful, okay? And most of you guys know that it's super helpful. So let me shut this recording so that way we can continue our class.